You know those little bumps you sometimes feel on your bones and maybe just, ignore?
Hmm.
Today, we're doing a deep dive into one possibility, osteomas.
That's right.
Think of this as your quick, essential guide. We've got some revision notes here, and the mission is really just to get clear on what they are, why they happen, all that stuff. Ready.
Absolutely. So osteomas, basically they're slow-growing, non-cancerous growths. Benign.
The 9, okay.
Made of mature bone tissue. And for most people, really, they're not a major health worry.
Good to know.
Yeah. And just to be clear, there's also something called an osteoma. Smaller, often painful, but we're focusing on the general osteoma type today.
Got it. General osteomas. So what actually kicks off this extra bone production? Is it known?
Well, that's still a bit of a puzzle, actually. The precise cause we don't know for sure.
Yeah.
But the thinking is it likely involves genetic factors, maybe some minor hiccups during development.
Okay.
And interestingly, they can be linked to some inherited conditions like Gardner syndrome, for example.
Gardner syndrome, right. Are certain people, maybe certain age groups, more likely to get them?
We do tend to see osteomas pop up more often in younger people, say
Mm.
between 10 and 30 years old.
10 to 30, okay.
Yeah. But beyond that age group, there aren't really strong, well-defined risk factors. Although, like we just said, some genetic syndromes can bump up the risk a bit.
Okay, makes sense. So drilling down a bit, what's happening like at the cellular level when an osteoma actually forms?
It's basically just an overenthusiastic production of normal bone tissue.
Yeah.
Just too much of it or the wrong spot.
Huh, just normal bone.
Yeah, essentially. Scientists think maybe genetic mutations are involved or
Mm.
some kind of disturbance in how the body usually regulates bone growth.
Right.
And these growths can happen either right on the surface of the bone, we call that periostele, or sort of deeper within the bone itself, which is endosteal.
Periostele and endosteal. Okay, so if a doctor finds a bony lump, how do they know it's an osteoma and not something else? What else could it be?
That's a really important question. There are definitely other benign bone things to consider.
Like what?
Things like osteochondromas, enchondromas, maybe even osteoblastoma, though that's slightly different again.
Okay.
So imaging becomes crucial here.
Right, the pictures.
Exactly.
Yeah.
X-rays are usually the first port of call. Then maybe CT scans or an MRI to get a really detailed look at the size, location, that sort of thing.
And sometimes biopsy.
Sometimes, yes.
Yeah.
If the imaging isn't perfectly clear or if something looks a bit atypical, then looking at the tissue itself under a microscope, a biopsy might be needed to be absolutely certain.
How common are these? Are lots of us walking around with them?
It's quite possible. Here in the UK, we don't have really solid prevalence data, which suggests they're relatively uncommon or at least uncommonly diagnosed.
Right.
They can affect anyone, any ethnicity, any gender.
Yeah.
And because they often don't cause symptoms.
Many probably go completely unnoticed.
Yeah.
Precisely. So if they are often asymptomatic, how would someone even find out they have one? Just accidentally.
Often, yes, an incidental finding on an X-ray for something else. Or if it's in a spot where you can actually see or feel it, it might present as a visible swelling.
Okay.
Or sometimes, depending on the location, it might cause a bit of local pain, maybe if it's pressing on a nerve or something.
Ah.
A classic example is one of the paranasal sinuses that could potentially lead to sinus problems, like blockage or recurrent infections. So location is key.
Right. Location, location, location. So if symptoms do show up or it's found accidentally, what investigations typically follow? You mentioned imaging.
Imaging is definitely the mainstay. An X-ray usually gives a good first look. You typically see a dense, well-defined bony mass.
Okay.
CT scans are great for showing the 3D structure and exact extent. MRI can be useful too, especially for looking at surrounding soft tissues.
And the biopsy again if needed.
And biopsy if there's any doubt, exactly.
So let's say someone gets diagnosed. What happens then? What's the management?
Well, if it's asymptomatic, causing no pain, no functional problems, not bothering the person cosmetically, the usual approach is just watching it.
Watchful waiting.
Pretty much. Maybe periodic imaging, say, every year or two, just to check it isn't growing quickly or changing. Often, no active treatment is needed at all.
And if it is causing problems, pain or cosmetic concerns?
Then surgical removal is the way to go.
Okay. Big operation.
Depends entirely on the size and where it is. Sometimes it's quite straightforward, other times more complex. Minimally invasive or endoscopic techniques can sometimes be used, which is great.
What about the long term? What's the prognosis like?
Generally, it's excellent. Really good.
That's reassuring.
Definitely. Remember, these are benign, they don't spread,
Hmm.
and if they're completely removed surgically, they very rarely come back.
And for those just monitored?
Also excellent. If it's small, stable, asymptomatic, the long-term outlook is very positive.
So mostly a pretty low-stakes situation then.
In the vast majority of cases, yes. Complications are minimal, precisely because they are benign. The rare issues that do come up are usually location-specific, like we mentioned, blocking a sinus or maybe blocking the ear canal if it grows there. But again, that's uncommon.
Got it. This has been super clear. Is there maybe a handy way to remember the key points? A mnemonic, perhaps?
Yes. We can use BOGSRed CMP.
BOGSRed CMP. Okay, break it down.
B for benign. O, often asymptomatic. G, growth is slow. S, surface or within burr, periosteal endoscope. R, relatively rare. E, excellent prognosis. D, diagnosis via imaging. C, common age 10-30. M, minimal complications. P, pain sometimes.
BOGSRed CMP. Benign, often asymptomatic, growth slow, surface within, rare, excellent prognosis, diagnosis via imaging, common age, minimal complications, pain sometimes.
Nice. Hopefully helpful for revision.
Definitely. Okay, let's try a quick example question based on that. Say a 25-year-old comes in, small bony swelling on their forehead, noticed it a while ago, seems to have grown very slowly, not painful at all. What's top of the differential and what initial test?
Okay, based on that description, slow-growing, painless bony lump in a young adult, osteoma, is the most likely diagnosis.
And the test.
Initial investigation.
Yeah.
An X-ray would be the most appropriate first step.
Perfect. That really pulls it together. So I guess the main takeaway here is that osteomas are generally benign bone tumors. Outlook is great. Often no treatment needed at all.
That's the core message, yes.
Great stuff. For anyone listening who wants to dive deeper into bone tumors or other related topics, definitely keep exploring. And of course, for those prepping for exams, check out passthemsra.com.
And freemsra.com also has useful resources.
Absolutely. You know, it's fascinating how even these seemingly quiet, minor things like an osteoma really highlight how complex our bodies are.
They do.
Makes you wonder, doesn't it? What other subtle processes are going on all the time, holding hidden lessons?